Let's see an NCLEX RN video based on care for patients with spinal cord disorders. A patient is admitted with a C5 spinal cord injury. On admission, what is the highest nursing priority intervention? Assessing motor and sensory function, maintaining spinal cord precautions, assessing vital signs for symptoms of shock, preparing for an MRI scan. So here the patient is having a spinal cord injury. The highest priority intervention is to maintain spinal cord precautions to immobilize the spine and prevent further damage to the spinal cord. A 30-year-old male with a C-spine injury is placed in a halo vest for which of the following reasons? A halo vest, is it to decrease the infection, to prevent the spinal shock, to immobilize the spine, or to hasten wound healing? A halo vest is used to immobilize the spine. The pins are placed in the skull to lock the head in place and maintain immobility to prevent further damage until the spine can be fused. Following surgery to remove a spinal tumor, the patient states that she has a headache. The nurse knows that this may be a clinical manifestation of which condition? Sexual dysfunction, spinal instability, paralysis, CSF leak. CSF leak is one of the most common complications associated with spinal surgery. If the dura is punctured during spinal surgery, CSF is lost and the brain can sink down into the skull, placing pressure in the neurological tissues, resulting in deficit and a severe headache. The nurse assessed the patient for which early findings in amyotrophic lateral sclerosis, bowel and bladder incontinence, respiratory distress, muscle cramps, paralysis. So, amyotrophic lateral sclerosis, in that condition, both upper and lower neurons degenerate and die. Unable to function, the muscles gradually weaken, atrophy and twitch, which is known as fasciculation. The clinical manifestations mainly the patient shows are general complaints of muscle cramps or stiffness, muscle weakness on one part of the body first, slurred speech and difficulty swallowing. And this early clinical presentation depends on which part of the body is damaged first. A 24-year-old with a history of a fall last year and resultant T1 injury is admitted for severe headache and nasal congestion. On assessment, vital signs reveal bradycardia and hypertension. The nurse determines which of the following is the probable cause of the symptoms. Absence of deep tendon reflexes, distended bladder, respiratory distress, overexertion. Autonomic dysreflexia. It is a syndrome which is seen in patients with spinal cord injury above T5, T6 levels. This is mostly seen after the first year of injury, but it can occur any time after the spinal shock subsides. And the clinical manifestations shown in autonomic dysreflexia are severe headache, hypertension, bradycardia, tachycardia, diaphoresis, and flushing above and pallor below the injury level. So here the patient is experiencing autonomic dysreflexia. And the different causes of this autonomic dysreflexia are full bladder, then it can be a full bowel. Other causes include tight clothing, GI disturbances, deep vein thrombosis, pressure injury, bladder or kidney infection, temperature extremes, lying or sitting on a hard object, or a minor injury. So here it is distended bladder. The nurse recognizes which factor is placing a patient at the greatest risk for new onset of low back pain problems. Sedentary lifestyle, recent long-distance car trip, prolonged standing, cigarette smoking. Risk factors for low back pain include obesity, cigarette smoking, poor posture, stress, poor physical condition, poor sleeping position, and occupations that require heavy lifting. Nicotine in cigarette is thought to interfere with the vital nutrient absorption by the intervertebral disc, leading to disc degeneration, hence leading to low back pain. In completing the history and physical assessment of a patient with back pain, which findings is most suggestive of a herniated nucleus pulposus? Constipation, numbness in left lower extremity, hyperactive reflexes, hematuria. The patient with a herniated nucleus pulposus typically present with pain caused by inflammatory porosis as well as compression to the nerve roots. This nerve root compression can result in numbness in the affected extremity as well as pain, weakness, and inability to control the motor movements in the affected area. The nurse correlates which diagnostic result is most occlusive diagnosis of a multiple sclerosis. MRI changes in at least 2 separate locations, elevated ESR, elevated WBC, decreased CSF protein levels. For a definitive diagnosis of multiple sclerosis, the patient must have at least 2 separate symptomatic events or MRI changes in at least 2 separate locations. Elevations in ESR and WBC are not diagnostically definitive as many neurological conditions or disorders have an inflammatory component. Protein in the CSF level, it increases. Again, while not it is diagnostic, are usually in multiple sclerosis. The nurse monitors for which complication in patient with bulbar ALS? Lower back pain, dementia, paresthesia, dysphagia. Bulbar amyotrophic lateral sclerosis is a form of amyotrophic lateral sclerosis that prominently affects the muscles involved in speech, swallowing, and tongue movements. So here, dysphagia. There is no cognitive change associated with ALS and there is no change in the sensory function. So paresthesias are not seen in patients with ALS. Which interventions are indicated to treat the loss of vasomotor tone in the patient with acute spinal cord injury? Positive inotropes, corticosteroid, antispasmodics, IV fluids and vasopressors. Loss of vasomotor tone causes blood to pool in vessels and result in low blood pressure. IV fluids, vasopressors and inotropes are often used to provide adequate fluid resuscitation and increase the tone and increase the cardiac output. Which action is the highest priority in the patient who present with autonomic dysreflexia? Prepare for intubation, initiate vasopressors, remove the stimulus, place a temporary pacemaker. Autonomic dysreflexia develops when a strong sensory input such as pain, distended bladder, rapid temperature changes, infection, or a full rectum is carried into the spinal cord via intact peripheral nerves. This input travels up the spinal cord and evokes a massive sympathetic surge from the intact thoracolumbar sympathetic nerves, resulting in widespread vasoconstriction causing peripheral arterial hypertension. Immediate interventions are carried or aimed at removing the stimuli. For example, removing an impacted bowel, draining a distended bladder, providing pain medications, etc. Additional interventions include the administration of vasodilators to decrease the blood pressure. Which intervention is typically the initial treatment of a metastatic spinal cord tumor? Radiation therapy, local chemotherapy into the cord, surgical decompression, corticosteroid. Radiation therapy may be used following an operation to eliminate the tumor remnants or to treat inoperable tumors. It is often the first-line therapy for metastatic tumors. Surgery is used for tumors where removal possesses limited permanent nerve injury. Chemotherapy has not been found effective with spinal cord tumors. Corticosteroids may decrease the inflammation surrounding the tumor but are not a definitive treatment for a metastatic tumor. Cynthia is a 38-year-old female who presents with complaints of intermittent numbness in her left lower extremity and gait imbalance. She is obese with a history of poorly controlled type 1 diabetes mellitus. During the assessment, Cynthia has left lower extremity numbness and previously unnoticed weakness. This is affecting her balance, causing gait ataxia. Also notices increased reflexes in Cynthia's left arm and leg and visual changes in her right eye. An MRI of the brain and spinal cord is ordered to reveal any CNS process that may be present. Because India has poorly controlled diabetes and because of her upper motor neuron signs, that is increased reflexes and leg weakness, the healthcare provider also wants to rule out amyotrophic lateral sclerosis as a potential cause of Cynthia's current deficit. The MRI of the brain and spinal cord reveals lesions or plaques associated with multiple sclerosis. The healthcare provider then orders blood test and lumbar puncture to send CSF for testing to rule out other inflammatory or infectious processes. All of the results are normal. Cynthia's CSF results demonstrate increased immunoglobulin G synthesis rate and IgG index, which indicate increased rate of IgG production and higher levels when compared to serum levels. These increased IgG levels signify an inflammatory process. It can be a multiple sclerosis, infection, cancer, etc. is occurring within the central nervous system. Cynthia's CSF results also show a slight increase in protein and a normal WBC count. The result indicate possible multiple sclerosis. Here, during the follow-up appointment, she is informed that she may have MS, but for a definitive diagnosis, the patient must have at least 2 separate symptomatic events or MRI changes in at least 2 separate locations. She has started physical therapy twice a week and reports that her symptoms have improved and her balance is better. Cynthia has been trying to reduce the stress and has continued to lose weight by following a healthy diabetic diet and a supervised exercise program with a trainer at a local gym. She has been in several months without any further deficit developing. 6 months later, Cynthia again reports left leg numbness and weakness and a new symptom of arm weakness and numbness. A second MRI of the head and spine is completed, revealing new areas of demyelination. Cynthia is formally diagnosed with multiple sclerosis. After a long discussion with her healthcare provider, she agrees to begin beta-sauron therapy in hopes of reducing the exacerbations and slowing the progression of the disease. Cynthia decides to start Avonex intramuscular injections once a week. She is also given a prednisone course to treat her exacerbation and her clinical manifestations improve within 2 weeks. Cynthia returns to physical therapy to develop an exercise plan to strengthen her muscles and improve the daily function. She may also require medications to treat common complications associated with multiple sclerosis. These include medications to help reduce fatigue, depression and pain, and to help control bowel and bladder problems. Cynthia is given information regarding lifestyle changes to her diet and the importance of continuing her exercises and getting plenty of rest. It is vitally important that she take good care of herself to help try to reduce the disease progression and exacerbation. Cynthia is also given the numbers and websites for both local and national associations that can provide additional support and information. The nurse needs to monitor Cynthia for which complication of multiple sclerosis: intolerance to cold, myopia, muscle spasm, tinnitus. So muscle spasm are common complication in multiple sclerosis. Because of the loss of muscle tone, it causes stiffness and spasm. Which statement by Cynthia indicates that teaching about Avanox has been effective? I am so glad I am only have to do this once a week. I hope that my husband can help since it is 3 times a week. I am glad this medication does not cause the flu-like symptoms like pitoserone can. There is no increased risk for infection. So Avanox is a medication that is given IM once a week. What exercise modification need to be included in Cynthia's plan of care? Increasing weight and repeating 3 times a week, exercising in a warm environment to relax muscles, low to moderate intensity endurance training, high intensity resistance training. So here the patient need to go for a low to moderate intensity endurance training because it helps improve the strength and functional capacities of the patient. The nurse monitors for which clinical manifestation of Cynthia's multiple sclerosis: blurred vision, speech problem, muscle weakness, bradycardia, fasciculations. In multiple sclerosis, blurred vision, speech problems, and muscle weakness is seen. Based upon her current clinical presentation, the nurse incorporates which problem with Cynthia's plan of care: bowel dysfunction, impaired mobility, urinary retention, visual deficit. So in the plan of care, impaired mobility is the main problem for the patient. Hope you understood this video. Thank you so much.